right, everybody, how's it going? I know it's been a little bit since I've done one of these chapter check-ins. I'm trying to get them done. Life just keeps taking over. But this is Real Talk with Miss Wendy. I am Miss Wendy. This is chapter check-ins, and we're getting ready to start chapter 4, Skin Diseases and Disorders. Whoops, disorders and diseases, excuse me. Um, this one is going to be full of definitions, right? This is how you're going to pass the test. You got to know the definitions. Now, I'm going to tell you right up front, I do not know every answer on the test. I say this every time because I've been doing this a long time. I would love to say I remember the entire book, but I don't. So, with the definitions, it's going to be one of those things like there's some of them that I just know because I've done them enough times and they just stick out in my mind. There's others that I just don't know. Again, I encourage you to look up any of the answers that you don't have a comprehension for. We're going to use critical thinking skills as we always do with these tests. We're going to break down the question. We're going to eliminate any of them that just don't make sense. We're going to look for keywords. We're going to always choose B if we don't know the answer. We're going to consistently choose B if we don't know the answer. And before we get started, FYI, I have my grand dog here today. He can be a little bit spastic, so if you hear anything in the background, that's what's going on. And for some reason, every other animal in my house has decided to join us today. So again, it's Real Talk with Miss Wendy. So here we go. Question 1. All of the following are reasons cosmetologists should understand the skin structure and common skin problems except this one. So what it's basically saying is every one of these answers are appropriate for us except one. So which one doesn't look like the rest of them is what it's basically saying. So I like to try and read the first couple of words and move on to the next. When I get into these long sentences, I'm not a big fan. I'll read them if I have to, but I try to avoid it. If I can decipher a couple of them and get rid of a couple just by reading the first few words, that's what I'm going to do. So providing skincare services requires an understanding of the skin structure and common skin problems. That's true. Appropriate skincare preparations to clients requires thorough knowledge. Recognizing when salon services can be safely performed is crucial. Recommending medications to treat skin conditions requires an understanding of common skin disorders. That is the one that sticks out for me, and here's the reason why. I've said this before in other ones. We do not diagnose. We are not doctors. We simply say, it appears you may have. So we cannot recommend medication to treat skin condition because we don't know what that skin condition is for a fact because we're not a doctor. So the answer is going to be D. Let me check my test answer key, and that is correct. Question 1 is D. What should be used to determine when to treat a skin condition? What standard, When treatment requires breaking the skin or treating an open wound, the client should be referred to a healthcare provider. That is true. Only a cosmetologist with a dedicated specialization in skincare therapy should treat skin conditions. Don't like it. When in doubt, refer the client to a healthcare provider. Okay. Cosmetologists should only treat skin conditions in the initial stages of development. A long-term skin condition should be referred to a healthcare provider. Okay. What standards should be used to determine when to treat a skincare condition? I think it's A. If the skin is not broken, we should be able to treat it because it's just on the surface. But let me check and make sure it is not. Okay. Here's what they did. When in doubt, refer the client to a healthcare provider. Now, I just told you that in the question before, but I didn't like the part where it said when in doubt. I could be completely confident, or I could be completely confident that you have psoriasis, right? But that doesn't mean I'm going to treat it. I'm going to refer it to the physician no matter what. So that's why I didn't really like that one. That one's going to trip you up if you choose it. So for 2, the answer is C. Always refer to a healthcare provider. 3, which sentence best describes visible differences in lesions that can be used to classify the lesion as either a primary or a secondary lesion? Got it. Primary lesions are a different color than the surrounding skin, whereas secondary lesions have an accumulation of material on the skin surface. Now, I believe that is the correct answer, but let's go ahead and go through the other ones. Primary lesions are typically red or pink in color. Secondary lesions typically are gray or purple. That's bogus right there. Primary lesions are closed. Secondary lesions discharge watery fluid or pus. That's a pretty viable answer, but I still think it's A. Primary lesions are flat compared to the surrounding skin, whereas secondary lesions protrude above the surface of the surrounding skin. I don't think that's accurate. So for question 3, it is A. Primary lesions are a different color than the surrounding skin, and then your secondary lesions are the ones that have all the material or the debris built up. All of the following are examples of primary lesions except, okay, so all of these are primary lesions except one of them. So is it cysts, pustules, ulcers, or tumors? My initial guess is tumors. It's a pretty good guess. But let's see. 4 is C, ulcers. Okay, ulcers are open. They are going to have material on their surface. A tumor is closed. There is no material except for itself. So my bad again. This is not going to be an easy chapter to get through for me. It's funny because I used to teach skin theory only. I never taught the actual practical. But for some reason, taking these tests, I get confused with what's what. So I'm sure you do too. So let's go through them. Again, 5. All of the following are examples of secondary lesions except one of these. So which one does not have material built up on it? A macule, a crust, a scale, or a fissure? I believe it's a macule. Number 5A is a macule. A macule, I think it's a freckle. I'm pretty sure. I could be wrong. Look it up. 6, a small elevation on the skin that contains no fluid but may develop pus is secondary, a papule, freckle, or stain. Small elevation on the skin contains no fluid but may develop pus. I believe it's papule because once it develops pus, it's called a pustule. Let's see. 6 is B, papule. 7, blank refers to a skin sore or abrasion produced by scratching or scraping. I just know that one from memory. That one is A, excoriation. Obviously a stain, that's a birthmark. Psoriasis is an internal condition that externally shows itself. Keratoma is a buildup of scar tissue. So excoriation, I just know, is a scar. So 7 is A, excoriation. 8, which sentence best describes the difference between an open comedo and a closed comedo? Here's those big long answers I don't like to read. So an open comedo is a lesion from which pus discharged onto the skin surface. Okay. An open comedo is a lesion where a visible opening in the skin. An open comedo is where a white head in which the sebum has been exposed to the environment. An open comedo is a black head in which the sebum has been exposed to the environment. So what is this question again? What sentence best describes the difference between an open and a closed? Best describes. All right. That is not, I don't like that one. Visible opening, closed comedo is a lesion without a visible opening. That is correct. I believe it's B. 8. Oh, shit. 8 is D. I was wrong again. It's a blackheaded. Okay. Oh, this, yes, I know this. Now that I'm reading it, I knew this. An open comedo is a blackhead. A closed comedo is a whitehead. And the whitehead just means that the sebum is still intact. It's still in the skin and it hasn't been exposed to the environment yet. My apologies. Question 8. What is the difference? The answer is D. Open comedo is a blackhead. Closed comedo is a whitehead. And which sentence best defines rosacea? For question 9. All right. I know that rosacea is a chronic skin inflammation. So it does is visible primarily on the cheeks and the nose, and it's characterized by flushing that can progress to pustular type breakouts. It also can be caused by chronic inflammation as the sebaceous glands. So it's either B or C. Let me take a look. 9 is C. It is a chronic condition. It appears primarily on the cheeks. I always reference Renee Zellweger. I'm getting kind of old, so I might have to come up with a new celebrity for that. But she has rosacea. It's very obvious that she has rosacea. Okay, 10. All of the following are examples of disorders of the sudoriferous glands except. So every one of these have to do with the sudoriferous glands except one of them. Well, I know the sudoriferous glands has to do with the sweat. So I'm going to go with whatever doesn't have to do with the sweat. There he goes. He's decided to bark. Anhidrosis, acne vulgaris, aperhidrosis, malaria rubra. I wonder if this is supposed to be an H. This is not correct. I really think it's B, but let's take a look. 10 is B, acne vulgaris. Okay, this is a mistake on the test. This word right here is actually hyperhidrosis. They put an A instead of an H. He's being really, really spastic. Okay, 11. Contrast the treatment you would recommend to a client for anhidrosis versus the treatment for bromhidrosis. Well, you got to know what those are, which again is why you got to know your definition. So anhidrosis is lack of. Bromhidrosis is stinky sweat. So anhidrosis can be improved by using a hydrating sunscreen. Anhidrosis can be improved with a mild exfoliating treatment. Anhidrosis can be life-threatening. Anhidrosis can be helped by using a non-fatty skincare product. Okay, and I know bromhidrosis is for stinky sweat. I really think it's C. Anhidrosis can be life-threatening and should be referred to a medical professional, whereas bromhidrosis only requires a medical referral in severe cases. So number 11 is C. Number 12. What is the name given to chronic skin disease characterized by moderate to severe inflammation, scaling, and sometimes severe itching? Conjunctivitis, rosacea, impetigo, eczema. Okay, chronic. Conjunctivitis has to do with your eyes. Rosacea has to do with your sweat glands. Impetigo is that one where you like do this and you get the spots all around your face. Usually kids get it from wiping their nose. Eczema is definitely a chronic skin disease. So we're going to go with 12 is D. That is correct. Eczema. 13. Select the most appropriate response for when a cosmetologist has a client with an eye infection that covers the whites of the eyes and the eye is covered with a crusty substance. Just told you what that one is. It's going to be conjunctivitis or pink eye, as it's commonly called. So I'm looking for one of these that have pink eye in it, and there we go. Advise a client that they may have pink eye, so you may have, which is highly contagious and should be addressed in a consultation with a healthcare provider. I know that the answer is A. We're not going to worry about any of these others. So 13. What? Okay. 13. D. I hate this test. All right. Decline to service clients and suggest they seek medical advice without speculating as to what is causing the eye condition. All right. I believe A would have been okay. Behind the chair rules. State board says absolutely not. You suggest that they seek advice. You do not speculate as to what's causing it. So here's the problem. I'm okay with saying they may have pink eye. State board is not. State board says you don't speculate as to what it is at all. You just send them to the doctor. I get it. I understand. When we're taking a test, you're going to scale back and say, nope, don't know what it is. Can't even say it may appear to be. I'm just going to send you to the doctor. So 13 is D. A client is an appointment for a facial and asks whether to reschedule. There's a new lesion on the nostril in the same place where there was a previous lesion that lasted for 3 weeks. What is the likely explanation for this lesion? It's a bacterial infection of Staphylococcus causing a weeping lesions of impetigo around the nasal passages. It's a case of rosacea that appears on the cheeks and nose and can present as pustular type breakouts. It is a skin cancer, squamous cell carcinoma, which is characterized by scaly red or pink papules or nodules. It is a viral infection of herpes simplex 1, which often present as a reoccurring vesicle on the lips, nose, or other parts of the face. Well, this is a crap question. 14D. This is a crap question because every single one of these answers means I have to know what the issue is, and I do not have to know what the issue is because I'm not a damn doctor. But 14 is D. It's a viral infection of herpes simplex 1, which often appears as a reoccurring vesicle on the lips, nostrils, or other parts of the face. I always think of herpes being on the lip, but it does go on other areas around the face. So the answer for number 14 is D. My poor doggy is just crying. Yes, you're crying. And I'm busy, and I need you to be calm. Number 15. Which skin hypertrophy is characterized by red patches covered with silver white scales? Red patches covered with silver white scales. Well, that's psoriasis. Let's see if I'm right, because I haven't been very right on any of these today. 15 is A, psoriasis. It's not a keratoma, which is scar. It's not a verruca, which is a wart. It's not eczema, which is a yellow scaly. It's psoriasis. Which description best matches a keratoma? It is a superficial thickened patch of epidermis, I do believe. So 16, we are going with C. It is a superficial thickened patch, which is a scar, right? A superficial thickened patch. Fancy way to say a scar. Which pigmentation or disorder is a genetic condition in which there's an absence of melanin pigment in the body, including the skin, hair, and eyes? Okay, so vitiligo is spots of absence of pigment. Albinism is the answer. So B. That's a pretty easy one. Most people are going to know that one. 17 is B. All of the following contribute to acne development except P. acne on the surface of the skin, overproduction of sebum by the sebaceous hereditary tendency of the skin, obstructions blocking oxygen from the bottom of the follicle. I don't like D. 18 is A. Okay, all of the following contribute to acne development except, okay, so apparently P. acnes does not cause acne. It probably is acne, actually. So all of the other things are going to cause acne. 19. The following are all treatments of mild form of acne except this one. All the following are all treatments for mild forms of acne. Okay, exfoliation treatments that gently slough dead skin cells, harsh facial cleansers to remove the buildup of sebum, foamy rinse-off products that remove debris and oil, toners that treat excessively oily skin. Mild forms of acne, I would say B. 19 is B. Harsh facial cleansers that remove the buildup of sebum. The clue here is the harsh word. Facial cleansers to remove the buildup of sebum, fine if you have acne. Harsh, not so great. That's the word. 20. All of the following are examples of extrinsic factors that influence skin aging except UV radiation, alcohol use, gravity, and pollution. Okay, here's the thing. Extrinsic factors actually means things that you do from the inside, I do believe. Let's verify that. 20. Okay, extrinsic are factors that happen in the outside, external. They happen from the outside and they affect the inside because of it. UV radiation, outside. Alcohol use, things you use from the outside going in. Gravity, Outside. Pollution. Outside. So which one is not outside? So 20 is gravity. Gravity has nothing to do with skin aging, right? So people will say, "Oh my gosh, gravity took over on your skin." Has nothing to do with it. UV radiation, alcohol use, pollution. Yes, that all has stuff to do with it. 21. What is one way that sun exposure negatively affects the skin? Natural weakening of the collagen, elastin fibers happens at a much faster rate. The sudoriferous glands discharge foul smelling perspiration, usually noticeable in the armpits or on the feet. Sun exposure. The epidermis acquires superficial thickening in patches. The skin develops hypopigmented spots and splotches. One way that sun exposure negatively affects the skin. Okay, well, it definitely does D. It does A. I don't know it. That has anything to do with it. Superficial thickening in patches. Okay, 21. Okay, A is the only one that fits. I had to look at the answer to figure that one out. The natural weakening of collagen and elastin fibers happens at a much faster rate. That is what happens with sun exposure. It's not going to get thick. It's not going to it is going to have foul smelling perspiration from the sun, but not from the sun exposure, and how it negatively affects the skin. 22. Which type of skin cancer is characterized by scaly, red, or pink papules or nodules? Basal cell carcinoma, squamous cell carcinoma, actinic keratosis, or malignant myeloma? I do believe it's C, but let me see what I have not been doing well with this one. B. Squamous cell carcinoma. Scaly, red, or pink papules or nodules. Squamous cell carcinoma. If you don't know it, look it up. That's going to be the answer for that one. 23. The following are all changes that occur over time in existing moles and could be indications that the mole is cancerous, except one of these. Ragged and notched. Yes. Half of the mole does not match the other half. Yes. Large dark hairs growing out of the mole. The mole's color is not the same all over. Ooh, I kind of like C. 23 is C. Large dark hairs grow out of the mole has nothing to do with whether it's cancerous. 24. All of the following are recommended to help cosmetologists prevent contact dermatitis, except... Okay, so here's the except word. So all of these things are going to be good, except one of them. Wear gloves and work with irritating chemicals. Yes. Keep brushes, handles, containers, vaccinating for product residue. Yes. Keep tools, equipment, and surfaces clean and disinfected. Sanitize the skin to the irritant by exposing it to larger and larger amounts, or sensitize. Well, that don't make no damn sense. So 24 is definitely D. Correct. All right, 25. Last one. Blank is an allergic reaction created by repeated exposure to a chemical or a substance. Sensitization, impetigo, anhidrosis, conjunctivitis. Well, I think it's B. 25. A. Sensitization. Sensitization is an allergic reaction created by repeated exposure to a chemical or a substance. Okay. Sensitization. 25 is A. That is your examples of all of your test questions. Again, you're not necessarily going to get these test questions. You could not. If you are a SEMA user that comes from a bank, so you're not going to necessarily get all of these questions. If they still do paper tests, you very well may get one of these. In that case, I can tell you, yep, I gave you every single answer to this test. Is that going to help you pass the state boards? Absolutely not. You cheat your way through your test while you're in school, you will fail your state boards. It's just a fact. I get it. A lot of students will cheat their way through just to get through that test because I've got to move on to the next one, or I've got to keep going and I didn't do well on that one. I'll pick it up later. What happens is you get all the way down to the end and you never actually go back and do the work that you were meant to do in the first place. And that's where you will fail your state board. And they no longer require you in the state of Florida anyways to go back to school if you fail your state board 3 times for 40 hours like they did. They've taken that away. So you can just keep repeating the test over and over and over again. I've seen students take the test 5 times, five, before they actually passed. Um, that is someone who is not studying. That is someone who is not taking it seriously. That is someone who thinks I know everything instead of humbling themselves and actually doing the process that you need to do to pass the test. So that's my 2 cents. I hope this helps you for Chapter 4, Skin Diseases and Disorders, or Disorders and Diseases. And I'll see you next time when we do Chapter 5. Have a great day. Good luck.